Welcome to Idea Sessions. In this video, we will cover 10 crucial steps you must take to heal from emotional trauma. Acknowledge the trauma. It involves recognizing and accepting the pain and impact the trauma has had on your life. Denial or avoidance can prolong suffering, making it harder to move forward. By facing the trauma head-on, you validate your experiences and emotions, creating a foundation for recovery. This step often requires courage, as it means confronting painful memories and feelings. However, it is essential for healing, as it allows you to understand the depth of your hurt and begin addressing it. Acknowledgement is not about dwelling on the past, but rather about accepting its reality, which is vital for healing and growth. It opens the door to seeking help and implementing strategies for recovery, paving the way for emotional resilience and well-being. Build a support system. Surrounding yourself with compassionate and understanding people provides a sense of safety and belonging. Friends, family, and support groups can offer emotional comfort, practical assistance, and validation of your experiences. Sharing your feelings and struggles with trusted individuals helps to lessen the burden and fosters connection. A support system can also encourage you to seek professional help when needed and remind you that you are not alone in your journey. This network of support can be a source of strength, offering different perspectives and coping strategies. It's essential to choose people who respect your boundaries and allow you to heal at your own pace. With a strong support system, you can find hope, resilience, and the encouragement needed to navigate the path to recovery. Practice self-care. Engaging in activities that nurture your physical, emotional, and mental well-being helps rebuild your resilience and restore balance. Self-care involves prioritizing your needs, whether it's through regular exercise, a healthy diet, sufficient sleep, or relaxation techniques like meditation and deep breathing. It also means setting aside time for hobbies and activities that bring you joy and fulfillment. Taking care of yourself helps to alleviate stress, improve mood, and foster a sense of control over your life. It's important to listen to your body and mind, giving yourself permission to rest and recover as needed. By making self-care a daily practice, you create a supportive environment for healing, enhancing your ability to cope with the effects of trauma and paving the way for emotional recovery. Express your feelings. Bottling up emotions can intensify pain and prolong suffering, whereas finding healthy outlets for expression can provide relief and clarity. Whether through talking to a trusted friend, therapist, or support group, sharing your feelings helps to validate your experiences and lighten the emotional load. Journaling is another effective method, allowing you to explore your thoughts and emotions privately and deeply. Creative outlets such as art, music, or writing can also be therapeutic, offering a way to process and release feelings that might be difficult to articulate. By expressing your emotions, you gain insight into your trauma, facilitate emotional release, and foster a sense of empowerment. This step is essential for breaking the cycle of isolation and beginning the journey toward emotional recovery and well-being. Learn about trauma. Understanding the nature and effects of trauma can provide invaluable insight into your own experiences. By educating yourself about trauma, you can recognize common symptoms such as anxiety, depression, and flashbacks, which helps to normalize your reactions and reduce feelings of isolation. Knowledge empowers you to identify triggers and develop effective coping strategies. Resources like books, articles, and support groups offer diverse perspectives and practical advice for managing trauma. Additionally, learning about trauma can help you understand the physiological and psychological impact, fostering compassion and patience with yourself. This step encourages a proactive approach to healing, enabling you to seek appropriate therapies and support systems. With greater awareness, you can navigate your healing journey with confidence, resilience, and hope for recovery. Set boundaries. Establishing clear limits protects your emotional well-being and creates a safe space for recovery. Boundaries help you manage interactions with people and situations that may trigger or worsen your trauma symptoms. By defining what is acceptable and what is not, you regain a sense of control and self-respect. Communicating your needs assertively yet kindly to those around you ensures they understand your limits and can support your healing journey. Boundaries also involve prioritizing self-care and recognizing when to say no, preventing burnout and emotional overload. This process fosters a healthier environment, allowing you to focus on your recovery without unnecessary stress. With firm boundaries, you create a supportive framework that promotes healing, emotional stability, and personal growth, paving the way for long-term well-being. Practice mindfulness and meditation. These practices help you stay present, reducing the grip of past traumatic events on your mind. Mindfulness involves paying attention to your thoughts, feelings, and sensations without judgment, fostering a sense of awareness and acceptance. Meditation provides a structured way to calm the mind, reduce stress, and improve emotional regulation. Regular practice can help decrease anxiety, depression, and intrusive thoughts, allowing you to process trauma more effectively. Techniques such as deep breathing, guided imagery, and body scans can promote relaxation and a sense of inner peace. By incorporating mindfulness and meditation into your daily routine, you build resilience and enhance your ability to cope with emotional distress. This mindful approach supports your journey toward healing, fostering emotional balance, and promoting long-term well-being. Engage in physical activity. Exercise has profound benefits for mental health, helping to reduce stress, anxiety, and depression. Physical activity releases endorphins, which are natural mood lifters, and promotes better sleep and overall well-being. Whether it's walking, running, yoga, or dancing, finding an activity you enjoy can provide a healthy outlet for pent-up emotions and tension. Regular exercise also helps to restore a sense of control over your body, counteracting feelings of helplessness that often accompany trauma. It encourages a connection between mind and body, fostering awareness and grounding. Physical activity can also provide a sense of accomplishment and boost self-esteem. By making exercise a consistent part of your routine, you support your emotional recovery, enhance resilience, and create a positive foundation for healing. Seek professional help. Seeking professional help is a crucial step in healing from emotional trauma. Therapists and counselors specializing in trauma can offer personalized strategies and support tailored to your unique experiences. Professional guidance provides a safe, non-judgmental space to explore and process your emotions, helping to uncover underlying issues and patterns. Techniques such as cognitive behavioral therapy, eye movement, desensitization and reprocessing, and trauma-focused therapy can be highly effective in alleviating symptoms. Therapists can also teach coping mechanisms and resilience-building strategies, facilitating long-term recovery. Seeking help is a sign of strength, not weakness, and it ensures you don't have to navigate the healing process alone. With the right professional support, you can gain insights, develop healthy coping skills, and work through trauma more effectively, paving the way toward emotional well-being and recovery. Be patient with yourself. Recovery is a gradual process, and it's important to understand that healing takes time. Allow yourself to experience emotions at your own pace without rushing or forcing progress. Self-compassion and patience help to reduce self-criticism and unrealistic expectations. Recognize that setbacks are a normal part of the healing journey and don't define your progress. Celebrate small victories and be gentle with yourself during challenging moments. Practicing patience involves acknowledging your efforts and respecting your own timeline, understanding that healing unfolds uniquely for each person. By being patient, you create a supportive and nurturing environment that fosters emotional growth and resilience. This approach helps you build a more sustainable path to recovery, allowing you to embrace your journey with kindness and acceptance. Each person's healing journey is unique, so it's important to find what works best for you and to proceed at your own pace. If you found value in today's video and want to continue exploring mental health topics with us, subscribe to our channel for more insightful content. By subscribing, it will help us do similar videos. So, if you haven't already, subscribe and hit that notification bell to never miss an update. In the description below, they are links that can help you work on reducing your anxiety, stress, worries, and depression. Thank you for watching. See you in the next video.